Hi there, my name is Dr. Ryan Como. I'm very excited to show you an advanced hip assessment protocol using the Kinetisense 3D range of motion capture system. So when we're doing the advanced hip protocol for assessing the hips, what we're doing is we're trying to lock the hip out in the sagittal plane and assessing mobility in the frontal plane. So we have Maggie here. We'll do an assessment quickly. So here we're assessing the right hip because the right hip is down in that split position. First thing we want Maggie to do is we want her to try to lock out the front of the hip. So going into a posterior pelvic tilt, and automatically once she goes into that posterior pelvic tilt, we get flattening of the low back. She can feel tension in the front of that hip. We then go into having Maggie lunging forward, maintaining that pelvic tilt, hand on the hip, and once we get that lockout, we then test the lateral shift, trying to drop the body across without leaning the upper torso away. So this is simply a glide across with the body, right? We do the same thing from the other direction as well too. So maintaining this lockout, Maggie's going to put the hand on the left hip, and we're going to press over, trying to maintain shoulders square, and at least get it 3 inches to either side. So you can see that she's a little bit tight in this position. It's very hard to do this visually by eyesight, so it's great to have an assessment tool that can give us information and give us feedback as to if there is a body tilt and how much deviation is occurring in that plane, and that's why we use Kinetisense. So this hip protocol, along with the Kinetisense software, provides great insight as to the overall mobility of the hip in those planes, and if there's any regression or progression during the course of treatment. So when assessing the advanced hip protocol with the Kinetisense system, we have the advantage of being able to see how much deviation or tilt is occurring in the frontal plane of the shoulders and the hips. This information being on the left side of the screen. And we can also see how much deviation laterally occurs in that frontal plane on the right side of the screen. So in this case, just as we explained, we have Maggie go into that tilt, lock out the front of the hip, and then go into that lateral shift. Trying to maintain shoulders as square as possible so she has the biofeedback of the system to allow her to know if there are any tilts occurring, and she can feel that pull. Let's go into shift to the right, Maggie. Try to keep shoulders square, and to the left. And you can see here that she has much more mobility shifting into the left on this leg than she does going to the right. And that's presented with Kinetisense on the right-hand side of the screen from that transverse view. Great advantage to have the bird's eye view to be able to show how much shifting is occurring. And we would obviously do the same assessment with the opposite hip. So as a corrective to the advanced hip protocol, a great way to try to regain some of that mobility, and this is a great home care exercise as well, is called the wall tilt. In this position here, we have Maggie up against a wall. We make sure that the head and the hips are supported, and then we have that right knee bent in extension, trying to be behind the wall. Okay? It's also great to be able to measure the difference of the front foot to the knee. So the front left foot distance to the knee, we can measure this, and then we can compare that to the opposite side when we do this with the left leg down. So from this position, we're going to have Maggie go arms up overhead, going just like this, trying to maintain that pressure here. And then we're going to have Maggie, she's going into an arch now because she's now recruited the lats in this position. Right? And she also has that extension of the hip. So Maggie's going to now have to flatten her low back into my hand, make sure that the back of the neck is pressing and there's pressure there, and breathe. Ideally breathing diaphragmatically. You feel this stretch here. So from this position now, to actually get more of that frontal plane, she can go into that pelvic tilt, flatten the back, hand on the hip, and now try to glide her glutes along the wall, keeping that pelvic tilt. and making sure that the back is flat.